Thank you. On behalf of my colleagues and co-authors, I'll be presenting the results of our study, the validation of the Likert scale for surgeon-rated conspicuity of ureters with ASP5354 during abdominopelvic surgeries. These are my disclosures. Ureters can be challenging to visualize during surgical procedures and are susceptible to injuries. To help prevent these injuries, imaging options that provide clear visualizations of ureters are needed. Pedexacyaninium chloride, or ASP5354, is a novel near-infrared fluorescence imaging agent under development for intraoperative ureter visualization in 2 ongoing phase 3 studies. To assess ureter conspicuity, surgeons rated a single item question: how conspicuous is the ureter, using a 5-point Likert scale. This study assessed the inter-rater reliability between individual surgeon raters at baseline and intra-rater reliability within the same raters at baseline in 1 week at a retest. Here are sample images under white light and nerve signal showing varying degrees of ureter conspicuity. In the top left, you can see almost no difference between the white light and the nerve signal, rating a 1. In the bottom right, you can see a stark difference between the white light and nerve, rating a 5. Here's the study schematic. Surgeons who participated in this study had a mean experience of 22 years in a variety of specialties. Surgeons completed a training session, a baseline test, and a retest 1 week later. At baseline and retest, surgeons rated ureter conspicuity images from a phase 2 study of adults undergoing abdominopelvic surgery who had received ASP5354. 36 paired images were used, adding to a total of 72 images rated by each rater. The paired images showed the same anatomical area containing ureters with both white light and nerve signal. 18 of the images were taken at the beginning, approximately 10 to 30 minutes after administration of ASP5354. 13 images were taken in the middle of the procedure, 30 minutes after administration through the end of surgery, and 5 of the image pairs were taken at the end of surgery. The white light and the white light nerve image pairs were both shared on screen for 30 seconds while surgeons made the determination of rating. Here are the median rating scores by the 17 surgeons at baseline and the 15 surgeons at retest. The Likert scale demonstrated adequate reliability between individual surgeons with an inter-rater reliability of 0.702 and an intra-rater reliability with the same raters at a retest of 0.819. This graph here shows the individual scores for the 17 surgeon raters at baseline on the left and the 15 surgeons at retest on the right. These graphs show the baseline and retest, all rating scores were very similar. In conclusion, surgeons had adequate inter-rater and intra-rater reliability when rating the single item, how conspicuous is the ureter, with the 5-point Likert scale, supporting the utilization of this Likert scale for assessing ureter conspicuity in 2 ongoing phase 3 studies. Thank you for your attention. I'd be happy to take any questions.